What are we going to do about the economy? Why does a president, in his first primetime address as president, say, I'm going to reform health care in the first year when the economy is the issue? Help me on that. Why not take something easy? We had some other big issues in our economy. But the reason is very simple. And that's the starting point for where I think all of this discussion of health reform has to be kind of founded. We cannot fix the economy unless we spend less in health care. Period. As we're here today, we kind of have this interesting good news, bad news scenario about health care. Good news. Healthcare spending the last 3 years slowed to less than 4% per year. In 35 years, it's averaged 5.6%. It slowed to less than 4%. How many of your organizations across the board increased wages 4% per year? None. And that good news, that it slowed to only 4%, was at the same time, two other sets of data made it problematic. We find out that the GDP has struggled. Last year, our economy grew about 1.7%. Healthcare costs up 4%, GDP up 1.7%. That's a 2.3% gap. How do you make that up? In 2000, in this country, we had 70% of the employers in the country who provided health insurance. Today, it's 56%. 10 years from now, it'll be 40%. 20 years from now, employers will not be providing insurance at all. Your services will compete in a completely retail market. And you'll have to figure out what the value is to an individual who struggles just to understand their own medical condition and their treatment options. What's it mean to you? It means we're going to go into the 2014 election cycle. And according to the Congressional Budget Office, next year, health costs will increase back to 6.1%. 6.1%, and will increase for the next 10 years. We had a dip, it's coming back. What's that mean? It means there'll be an acceleration of the number of people who don't have insurance. It means bad debt goes up. It means state Medicaid programs, especially the dual eligible populations, will be the epicenter. That's going to be the governor's biggest headache. What it means is employers, 3% per year will drop coverage altogether, especially companies in the 100 to 500 size range. And it means in 2020, we'll have a national referendum on a single payer system. Single payer system. So it's not all bad. Remember, demand will grow. We're going to be out there. It's a very public discussion, and we're now having to think about, should politicians figure this stuff out? Or do we have to really make those determinations more at a market level, more at a state level? I think the feds have absolutely made a disaster out of health reform. And I would have voted for the Affordable Care Act. held my nose, does more good than bad, but the process of implementing it has been a disaster. But that's 2.0. That's what we're about to fix. That's kind of where this next wave is going.